peak of the pandemic was probably one of the most challenging and extraordinary things I've ever been through, which I'm sure is the same with many of us. And now almost seems like a little bit of a dream because it was so pressured and the challenges on us were so great. I think all of us will think back and think about some of the heartbreak that we saw. I particularly remember a couple of key patients that will stand out for me. One that of experience I had with the ICU team of a young man in his 30s that had struggled feeling unwell at home for several days, and then by the time he came into ED was extremely sick. And however much the ICU team tried, he unfortunately arrested and died a few hours later. And we all had to stand there and go through his mobile phone, trying to get the phone number of his mother to tell her that her son had died. I think all of us were just moved to tears with the real tragedy of what we were seeing. And for me, that is something I will never forget. I think we've all got those patients, those conversations, and even actually talking to our own staff who had been ill or their families had been ill. I think we've all had that emotional connection with so many people. But most of all, as well as the patients, it will be the staff that was the highlight for me. I've never worked with such an extraordinary group of people. I can remember many hours spending with Adam Broad as he tries to source PPE for our staff from anywhere in the country or anywhere in the world, because we were desperate to make sure that our staff were kept safe. People worked extraordinary hours, 7 days a week. They were available day and night. And actually there was an amazing sense of teamwork. Some of our staff were giving 2,500 hot meals a day to make sure that our staff were fed after they'd been in PPE. Our community gave an outpouring of good wishes and gifts. And I think we felt incredibly supported by everyone around us. But most of all, I felt proud to be a nurse. I felt proud to lead the nurses and midwives that I work with. But I was just proud of every staff member at King's. I think people showed extraordinary sense of camaraderie, hard work, and at times humour, actually. I think we all looked after each other, and there was an amazing sense of purpose. Everybody knowing every day when they came to work, they did a job that matters, and I feel incredibly proud of that. We're still living in the remnants of COVID. On a personal level, I cannot wait to be mask-free and be able to give people a hug spontaneously. So I'm waiting for the days when we can be able to get back to normal. Thank you.